So hi dear students, welcome to Surgery Dada. Today I have a very small, crisp, you can say discussion with you people. So I had a patient presented in the emergency with acute pain over the right upper quadrant, and this patient was suspected with gallstones. However, when we went for the ultrasound, we found suspicious pancreas and there was obstructive jaundice detected on the LFT. So remember gallstones with LFT, the next thing that we went for was MRCP. And do you know, this is the classical MRCP film of the patient. So what are the important structures? How will you look at? So this structure, this is your liver. So this is your liver. And can you see the two prominent dots here? These are the two prominent dots. So they may be looking like a double duct sign, but this is not a double duct sign. Normally, where do you see a double duct sign? You see a double duct sign in case of pancreatic adenocancer. However, a stone in the distal duct might cause an impaction and dilatation of the pancreatic duct also, but this is not a classical double duct sign. Can you see this is also. So this is a case of acute cholecystitis and due to gallstone. Now let us go to this section. Now let us talk about this. So can you see this is the gallbladder that we have? This is the pancreatic duct that we have. This is the pancreatic duct that we have. This is the CBD that we have. This is the left, this is the right, and then we have the right posterior and the right anterior, the left lateral and the left medial. So these are the classical ducts that you can trace in that. So left hepatic, right anterior, right posterior, right antero-posterior lateral, right anterior. So there are a lot of things that you need to understand here. But the most important thing is this is the gallbladder and this is causing impaction. Can you see? This is causing impaction on the CBD. This is the hilum. So if the gallbladder has a stone impacted at the neck and causing an impaction on the CBD, what is this? You can comment in the comment section below. Yes, you're thinking right. This is Mirrizi syndrome. And when we talk about Mirrizi syndrome, we have two kinds of Mirrizi syndrome. Type 1 where there is only physical impaction but no erosion and fistulization. In the type 2, not only do you have the erosion but you also have the cholecystocholedochal fistula, and that is the most difficult case that you have. I've already operated on this patient. Very soon I shall be sharing the video. And one more very interesting thing is that the shape of the gallbladder, this is looking okay. But this was, when we operated, we got a L-shaped gallbladder. So the gallbladder was something like this. So in this case, we got a very interesting case where we had an L-shaped gallbladder densely adhered with the CBD, and we shall be sharing that video also with you. So again, in nutshell, one more thing that I want to show you is that just focus on this film. Can you see this is the gallbladder and this is the pancreatic duct. So this is the main pancreatic duct that you are seeing in front of you. Can you see there are strictures? Yes, there are a lot of strictures. So there is a stricture. The duct is not having a proper, you can say, the proper traversing of the dive. So do you know this patient is a known patient of chronic pancreatitis? He had an acute exacerbation of attack also. Probably this is maybe, or this may be due to the acute cholecystitis induced pancreatitis or whatever be the reason. So what are the important things in a nutshell? This is the main pancreatic duct. So you can show in this, there is a main pancreatic. This is the place where you are seeing the Mirrizi syndrome, and these are the ducts. There is no ductal stricture. You can see this is absolutely neat and clean, and we have already done this patient. The patient is happy, the patient is getting discharged, and stay connected to me for such more clinical videos. Thank you.